Welcome to BLR training. Whether your workplace duties include safety-related tasks where employee health and safety are at stake, or office tasks that require a high degree of efficiency and productivity, drugs and alcohol can have a very negative impact. The bottom line is, the workplace is not a place where drugs or alcohol should be used. However, some people have an illness that leads them to abuse drugs and alcohol, and this behavior can spill over into the workplace. This training session will help you recognize when an employee is abusing drugs or alcohol, and know what you can legally do as a supervisor to protect your workplace and help the employee.
Hi, I'm Laura Piper, licensed clinical social worker. Every day I work with all types of people, many of whom struggle with mental health issues in the workplace. During this training, I'll be talking about ways you as a supervisor can help your employees who may have mental illness. The main objective of this particular session is to help you recognize and understand substance abuse. By the end of the session, you will be able to understand substance abuse, know the causes and symptoms, understand how it can affect work, know what the law says, and learn how to handle employees who use alcohol or drugs at work.
Before we begin the session, let's take a few minutes to see how much you already know about substance abuse in the workplace. When you're ready to begin, select Next. Select True or False, then Submit.
Let's take a look at why you, as a supervisor, need to be concerned about substance abuse in the workplace. It is estimated that at least 10% of the workforce has a problem with drug or alcohol abuse, costing employers more than $81 billion annually. Studies show that alcohol and drug abusers are far less productive, on average performing at only 67% of their work potential. Studies also show they use 3 times as many sick days. Abusers are also more than 3 times likely to have an accident on the job as other workers, and they are 5 times more likely to file workers' compensation claims. As you can see, drug and alcohol abuse is not only a problem at home, but also at work. Before you can learn how to detect substance abuse and take steps to help your employees who may be affected, you first need to understand what it is. Simply put, substance abuse is a pattern of using a substance for mind-altering effects, which leads to frequent serious problems at home and at work. Remember, the substance can be almost anything, such as drugs, both prescribed and illegal, alcohol, inhalants, cigarettes, caffeine, and even food. Many things can lead to substance abuse, including family history, depression, or low self-esteem. This illness can affect any one of your employees.
50% of people with mental health disorders are affected by some type of substance abuse. Of all drug users, 74.8% are employed. Substance abusers typically have poor performance, frequently call out or come in late, change jobs frequently, and struggle with productivity.
As a supervisor, the task of detecting substance abuse may fall on you. You are the one who oversees your employees' behavior on a daily basis. Select each tab to learn more. An otherwise inexplicable fall-off of work efficiency in terms of volume, accuracy, or promptness is often an early warning sign of substance abuse problems. A classic indicator is excessive tardiness and absenteeism, especially on Mondays and Fridays. An increased involvement in accidents and near misses, or an increase in the employee's error rate may occur. You may notice changes in an employee's appearance, such as weight loss or decreased hygiene. Substance abusers tend to have more frequent and severe changes in mood. One moment they can be cooperative, pleasant coworkers, and the next they may be confrontational, angry, or even violent. The substance itself can cause fatigue and drowsiness, or cause side effects such as inability to get enough sleep. A substance abuser may demonstrate a gradual diminishing of mental processes, such as an inability to grasp the meaning of facts that are clear to everyone else, to respond intelligently, to communicate clearly, or to make good decisions.
Now, it's time to see how much you are learning from the information presented so far. When you're ready to begin, select Next. Select the correct option, then Submit. Now, it's time to make sure you understand the information presented so far. For example, do you understand what we've said about what substance abuse is, how it affects the workplace, the causes and symptoms? It is important that you know and remember this information after the course is complete, so you can effectively deal with substance abuse if you need to. Next, we'll take a look at what the law says and steps you should take if one of your employees is dealing with substance abuse. Workplace substance abuse is not only a large and costly problem, but also an issue covered by an important federal law, the Drug-Free Workplace Act. Any organization that receives a federal contract of $100,000 or more, or a federal grant of any size, falls under this act. This law requires such organizations to have, and to distribute to all employees, a written policy explaining the rules against drug use in the workplace. The policy must state that employees can't use, distribute, sell, or make drugs at work. The law also requires the organization to have a drug awareness program to warn employees about the dangers of drug use, particularly at work. Employees convicted of criminally violating drug-free workplace rules must report the conviction to the organization within 5 days. The organization has 10 days to report the conviction to the government. Your organization then has 30 days to take appropriate action, which may take the form of discipline, up to and including termination. Or your organization can help the employee get into a government-approved rehabilitation program. The employee must complete the rehabilitation steps agreed on, or risk losing his or her job.
You need to be aware of federal law that protect American workers' rights. You also need to be aware of your state laws and how they may affect your organization. Select each tab to learn more. The Americans with Disabilities Act, or ADA, of 1990 states that it is illegal to fire, refuse to hire, or withhold a promotion from employees because they had a substance abuse problem or are currently in a rehabilitation program. This act also protects workers who have a physical disability that produces behavior similar to substance abuse, such as slurred speech, from being singled out for drug testing. Over half the lawsuits brought against drug-free work programs are for violations of the ADA, so you need to be careful. It's important to also note that an individual who is currently using drugs illegally is not protected by the ADA and may be denied employment or be fired on the basis of such use. However, an individual who has had a drug problem but is no longer using drugs illegally is protected, provided he or she has completed or is participating in a supervised rehabilitation program. There's also Title VII of the Civil Rights Act of 1964 that prohibits private employers with 15 or more employees from discriminating against staff based on race, sex, religion, or nationality. For organizations with 50 or more employees, the Family and Medical Leave Act, or FMLA, allows up to 12 weeks of unpaid leave, depending on tenure, for employees dealing with a substance abuse problem. This includes if the employee or a close family member is in rehabilitation or has a medical condition resulting from past substance abuse. Substance abuse may be a serious health condition if one of the tests for establishing an FMLA-covered serious health condition is met. FMLA leave may be taken only for treatment of substance abuse by a healthcare provider or by a provider of healthcare services on referral by a healthcare provider. Absence because of the employee's use of the substance rather than for treatment does not qualify for FMLA leave. Similar to the ADA, it's illegal for an employer to fire, demote, or withhold a promotion because an employee takes leave under these circumstances. Finally, depending on your organization, you may need to familiarize yourself with the National Labor Relations Act, or NLRA. Under this act, drug testing procedures and any penalties implemented on union workers must be negotiated with the union ahead of time. You play a key role in dealing with substance abuse in our workplace. Why? Because, as a supervisor, you are on the front line of our substance abuse awareness campaign. This puts you in a unique position to impress upon your employees the seriousness of the problem and to supply them with useful information about substance abuse and prevention measures. You are also the person who has primary responsibility for communicating workplace policy concerning drugs and alcohol. Furthermore, you are the one who monitors your employees' performance on a regular basis, which means you are the one who is most likely to notice the kind of behavior that indicates a possible drug or alcohol problem. Depending on your policy, you may implement reasonable suspicion testing if certain criteria are met. However, as supervisor, you should not address any drug or alcohol-specific issues. It's your job to address issues such as performance or safety problems and refer the employee to your EAP. Finally, you may be called on to administer discipline in some cases, or at least to warn employees that discipline may be needed if the employee does not take the required steps in the rehabilitation process.
Supervisors can play a key role in identifying substance abusers, and while it's never appropriate to criticize the employee's use of drugs or alcohol, it is appropriate to focus on work performance.
Documentation is another crucial issue in dealing with workplace substance abuse. Select each tab to learn more. Performance. First, establish a basis for comparison by keeping a record of employee performance, including late arrivals, absences, sick days, and other circumstances that have an impact on work performance. Incidents. Keep a comprehensive log of conversations held with employees involved in incidents, such as accidents and near misses. Document other out-of-the-ordinary incidents, such as fights or serious memory lapses, that might be alcohol or drug-related. Record dates, times, and witnesses. Patterns of behavior. Alcohol and drug problems develop over a period of time, during which individual occurrences may not be given their proper significance unless you have good documentation to help you recognize behavior patterns that may indicate substance abuse. Remember, patterns of work behavior should be work-related only. It is not your job to diagnose any mental or medical condition. Intervention. By staying aware of growing problems, you greatly improve the chance of early, beneficial intervention. Facts. Finally, by recording the facts as they occur, you also assemble solid support for your supervisory actions and recommendations. Your central role in the control of workplace substance abuse raises the important issue of confidentiality. As a person who may be directly involved in dealing with substance abusers, you will have access to privileged information that, for the most part, you must keep to yourself. Here's why. Employee privacy laws require you to keep any discussions with or about an employee suspected of having a drug or alcohol problem strictly confidential. This means that the only people you can talk to about this problem, other than the employee, are your manager, human resources, others in the organization with a need to know, and the healthcare professionals involved. They, too, will be committed to confidentiality. Confidentiality is important not only for legal and moral reasons, but also because it is more likely that the employee who needs help will agree to get it if confidentiality is assured. It will also be easier for the rehabilitated employee to return to work, knowing that he or she has not been the talk of the organization.
If your company has an employee assistance program, it can help you to refer the employee for treatment. It is important to protect the employee's privacy in terms of any information you may have concerning their drug use.
As a supervisor, you need to be prepared to act if you suspect that one of your employees is abusing drugs or alcohol on the job, or working under the influence. Select each tab to learn more. Perhaps the most important point is that you should never ignore signs that an employee might have a substance abuse problem. When you suspect a problem, talk to the employee privately and confidentially. In your discussion, explain your concerns in terms of safety and performance. Describe specific incidents that show why you are concerned, and explain how they could affect other people and tasks. This is where your careful documentation comes in. Finally, keep the focus on behavior, not personal issues. Don't attack the employee or make accusations about substance abuse. Give the employee an opportunity to respond. Expect the employee to deny that there's a problem, but also keep an open mind about the source of the problem. It could be something else. Alert the employee to programs within and outside the organization that can help with personal problems of any kind. Ensure the employee of your support if he or she seeks help. Re-emphasize that whether or not the employee chooses to get help, established standards must be met. Agree on a plan for improved performance and a timetable for monitoring progress. Warn the employee that if the problem persists, it will lead to discipline up to and including termination under the organization's policy. Monitor the employee's performance and behavior closely, documenting everything carefully.
Now it's time to see how much you've learned about dealing with substance abuse in the workplace. When you're ready to begin, select Next.
Select True or False, then Submit.
Let's take a moment now to make sure you understand the information presented during this training session. Do you understand what we've said about what substance abuse is, how substance abuse can have a big impact in the workplace, how to detect substance abuse, what the law says about substance abuse in the workplace, and what you should do if one of your employees has substance abuse problems? It's important to understand all this information so that you can effectively manage employees who are dealing with substance abuse. The key points to remember about this training session are: substance abuse is a serious and widespread illness. Substance abuse can have a big impact on workplace productivity. As a supervisor, you play a key role in detecting substance abuse among your employees. There are many workplace laws and confidentiality rules you must follow when dealing with employees who have issues with substance abuse. This concludes the training session on substance abuse. Please be sure to go back and review any information that is not completely clear. If you still have questions, ask your supervisor or trainer.